Screening for ocular cancer, unprovoked venous thromboembolism. Definition. Venous thromboembolism may be the earliest sign of cancer. Currently, there is a great diversity in practice regarding screening from ocular cancer in a person who has an unprovoked venous thromboembolism.
Started the conversation with disorders of whether it's in the lung, it's pulmonary embolism with potentially about 30% acute mortality. If the thrombus is formed as part of in the coronary vessel, then it's myocardial infarction. So these are very serious problems that people might have. Could you please talk a little bit more in detail about thrombosis? What are the common causes of thrombosis and what kind of strategies should be employed to properly diagnose people and to help them with the treatment?
So typically we divide up thrombosis into venous thrombosis or arterial thrombosis. And the hematologist tends to deal primarily with venous thrombosis. The arterial thrombosis, what we're talking about, is myocardial infarction, heart attacks, the realm of the cardiologist, or stroke, the realm of the neurologist. There's a little bit of overlap, but primarily my focus would be venous thrombosis, and this tends to be clots in the legs, and clots in the legs can break off and travel up to the lungs, causing a pulmonary embolism.
And also in many cancers, hypercoagulable state, when people are more prone to forming the clots, might actually be one of the first primary signs of the malignancy.
That's right. That's often how that disease can present. And that brings us into the hypercoagulable state. So who are the patients that get thrombosis? So cancer patients certainly are at risk. People who are immobilized, hospitalized patients, patients who have fractures that can't be as active as they had been, elderly people for similar reasons, obese people, pregnancy. So there's many different reasons. In recent years, we've uncovered some genetic predispositions. So factor V Leiden is now widely recognized as a very common gene polymorphism in people from primarily Northern European ancestry. Also, the prothrombin gene mutation is another gene abnormality that can predispose people to blood clots, and then various others. So elements of the clotting cascade. If protein C and protein S are missing, if antithrombin 3 is missing, these features, these entities will increase clotting risk. Most
The method. We thought to assess the efficacy of a screening strategy for occult cancer that include comprehensive computed tomography (CT) of the abdomen and pelvis in patients who had a first unprovoked venous thromboembolism. The primary outcome measure was confirmed cancer that was missed by the screening strategy and detected by the end of 1 year follow-up period.
Hi there. I'm Erica Wolf. I'm one of the nurse practitioner students working with Dr. Coleman today. Nice to meet you. What was your name? Kaylee. Okay. I'm just gonna wash my hands real quick. And what are you here in the office today for?
I need a physical for my new job.
Okay. What are you gonna do?
I'm gonna need personal trainer.
Okay. Have you done personal training before?
I have. This is actually the beginning.
Okay. All right. So how long have you been a personal trainer?
Probably 3 years now.
3 years. And you're moving to a new gym. What gym are you in? What kind of hours?
I'm gonna work day shifts, like 7 to 5 or 6, it depends on my clients.
Okay, so then during the day, do you exercise that whole time, or you have different blocks?
No, I'm like more so instructing my clients and I make sure they know how to do it, but I'm not actively exercising.
Okay. So do you do any exercise on your own?
I do.
Okay.
I work out like probably 3 times a day.
Okay. Do you do cardio or BTB?
Both.
Okay. Is that the only exercise you do? What have you done to prepare for this job?
I run marathons and I do some other like non-conventional physical like rock climbing and stuff like that. I also lift weights regularly.
Okay. Any previous injuries that was work related or exercise related?
No.
Okay. How about any injuries that maybe wasn't work related, like a motor vehicle accident or a fall or sprain your ankle running, anything like that? Okay. Very good. Now I'm going to have you close your eyes and look forward. Keep your eyes closed and feet together. We're going to do this for about 20 seconds here. And just looking for balance. 5 more seconds. That's really good. Okay, open your eyes. We're going to just look at your shoulders real quick. So arms up above your head. Very good. How about behind your back? Okay. Then maybe just a circle with each one. Make sure we do a full rotation. Good. Very good. Very good. You can, okay. Alright. Look at your sinuses here. So I'm going to feel on your forehead. Any pain or tenderness there?
No.
Okay. How about when I tap? No. Arteries. No. See your elbow on each side. Okay, clench your teeth for me. Open your mouth and shut it. Very good. Okay. Next, so preauricular, postauricular, occipital, jugular-digastric, submandibular, submental, superficial cervical chain.
The results of the 854 patients who underwent randomized 33 had a new diagnosis for acute cancer between randomization and 1 year follow-up. 14 of the 431 patients, 3.2% in the limited screening group, and 19 of the other. In the primary outcome analysis, 4 ocular cancers were missed by the limited screening strategy, whereas 5 were missed by the strategy of limited screening plus CT.
Venous thromboembolism, or VTE, is sometimes the first sign of cancer. But how often? Previous studies suggest that the rate of an occult cancer in a patient with a first unprovoked VTE may be as high as 10%. This leaves physicians with an important question. When a patient presents with a first-time unprovoked VTE, how aggressive should we be in searching for an occult cancer? The SUM trial compared limited cancer screening alone, which included basic blood work, a chest X-ray, and breast, cervical, or prostate cancer screening as appropriate to the patient's sex, age, and risk factors, with limited cancer screening plus a CT scan of the abdomen and pelvis. The primary outcome was a confirmed cancer diagnosis within 1 year after the initial VTE. In the trial, a total of 854 patients with an unprovoked VTE were randomized to receive limited cancer screening and a CT scan. After the initial workup, 10 cancers were detected in patients who received limited cancer screening, and 14 cancers in patients who received limited cancer screening and a CT scan. Over a follow-up period of 1 year, 4 additional cancers were found in the patients who had undergone limited screening alone, and 5 additional cancers in those whose screening had included a CT scan. These were all tumors thought to have been missed by the initial screening. There was no difference in the time to cancer diagnosis between between the two groups. This prospective trial found that the overall prevalence of occult cancer in patients with a first unprovoked VTE was low, at 3.9%. Adding a CT scan of the abdomen and pelvis to a limited cancer screening was of no benefit in such patients. Full trial results are available at nejm.org.
The results. There was no significant difference between the two studied groups in the mean time to a cancer diagnosis or in a cancer-related mortality. The prevalence of occult cancer was low among patients with the first unprovoked venous thromboembolism. Routine screening with CT of the abdomen and the pelvis did not provide a clinically significant benefit.